Cannabis sativa, or as you probably know it, marijuana, is a very controversial drug in present-day America. Many states have already legalized medical marijuana. Alaska, Arizona, Arkansas, California, Colorado, Connecticut, Delaware, Florida, Hawaii, Illinois, Maine, Maryland, Massachusetts, Michigan, Minnesota, Montana, Nevada, New Hampshire, New Jersey, New Mexico, New York, North Dakota, Ohio, Oregon, Pennsylvania, Rhode Island, Vermont, and Washington, along with Washington, D.C. Marijuana has many medical uses, including relief from pain, glaucoma, and nausea. It can even be used to stimulate the appetite in patients with cancer, HIV, or AIDS who are going through chemotherapy. If Congress removed marijuana's status as a Schedule I drug, its medicinal benefits would be recognized legally. Some concerns with legalizing medicinal marijuana include how to regulate the production, distribution, and sale of marijuana, as well as how to ensure that the drug is being used for medicinal purposes only. Unlike many prescription drugs, which cause a plethora of deaths every year in America, users can't overdose on marijuana, which is one of the reasons that the medicinal use of marijuana is more safe and beneficial to American citizens than other drugs. The legalization of marijuana would be valuable in many ways to the citizens of Texas and of the entire United States of America. Current Texas law states that the possession and delivery of marijuana is illegal in Texas. Possession is defined as the actual care, custody, control, or management of marijuana or products of marijuana. Delivery entails knowingly delivering marijuana or being in possession with intent to deliver marijuana, which is considered a state offense. Texas law also says that it's an offense to knowingly or intentionally possess a usable quantity of marijuana. In Texas, the punishment for these offenses depends on the amount of marijuana in possession of the citizen at the time of arrest. Currently, Texas doesn't recognize and hasn't legalized the use of medicinal marijuana, with the exception of cannabidiol, or CBD oil, which is used to treat intractable epilepsy. The 84th Texas Legislative Session stated that people who have epilepsy can be prescribed small doses of marijuana to help calm the effects of epilepsy. The strains of marijuana that have the most medical effects are the ones that have a low amount of THC but a high amount of CBD. The CBD in marijuana activates nerves in the brain to treat the affected areas. One little girl went from having 300 seizures a week to only 2 a month because her parents gave her medicinal marijuana. That's 600 times less seizures. It should be legal for doctors to prescribe marijuana to patients that can be helped by it. Texas's approach to medicinal marijuana is a problem that needs to be addressed. As of now, the only form of medical marijuana available is cannabidiol. To qualify for it, you have to have tried and seen no improvement with 2 different seizure medications and get approval from 2 doctors. Not only is it really hard to get qualified, but when you do, the medication is barely accessible because this form of legalization isn't very functional. Texas lacks the regulations to adequately provide the medicine for people with seizure disorders. We believe Texas's marijuana policy should be reformed because it is problematic that people need this medication not only for seizure disorders, but also for treatment of many other conditions, including cancer, Alzheimer's, and chronic pain. There is very little to no evidence that smoking marijuana is bad for your health. There have been no reported cases of lung cancer or other detriments attributed to marijuana. Texas's policy on medical marijuana makes it very difficult and time-consuming to receive a prescription for cannabis, and it only covers very specific medical conditions, so many would-be medical patients end up purchasing marijuana illegally. Even worse, the lack of protection for medical marijuana users means that authorities are free to arrest and prosecute regardless of whether it is being used medicinally. Texas's policies on marijuana take medical marijuana patients and send them to jail with no access to their medication, punishing them like drugged-up sleazes for seeking an effective form of medical treatment. Texas needs to reform its medical marijuana policy so that patients are free to use their medication without fear of being arrested or persecuted. A 52-year-old man suffering from diabetic neuropathy, which causes chronic pain and insomnia, was arrested after police found 1 marijuana plant and 1.5 ounces of marijuana in his home. He had turned to marijuana after trying sleeping pills, which caused him to sleepwalk. Another medical marijuana patient is facing up to life in prison. He was pulled over and his vehicle was searched, and officers found a small amount of hash and marijuana in his car. He is being held on $40,000 bail and is sitting behind bars without his medicine. A quadriplegic medical marijuana patient is also facing jail time after police found less than 2 ounces of marijuana on him. Texas, like several other states, has a zero-tolerance policy towards marijuana, whereas various other states disagree with the ramifications possession and distribution carry. Alongside Texas, Arizona has one of the toughest stances in policy against marijuana. Getting caught with less than 2 pounds of the substance carries a Class 6 felony charge with a minimum of a $1,000 fine. Missouri, Kentucky, Idaho, Wisconsin, North Carolina, and Tennessee are the few other states in the country against marijuana reform. These states have a higher rate of opposition towards marijuana legalization, basing their objections in the following: inhalation of smoke being detrimental to public health, its classification by the DEA as a Schedule I drug, and its potential for abuse. Like many other states, marijuana can be administered legally in Texas if a person suffers from debilitating issues and needs it for medicinal purposes, but only under very specific circumstances. Citizens can obtain their medical marijuana license for chronic ailments in 28 states and Washington, D.C. After researching the topic of medical marijuana, we believe that Texas should legalize all medical marijuana and make it more easily available to patients in need. The current law has too many restrictions and makes it very difficult for people in need to receive the relief they so desperately desire. We suggest that Texas make marijuana legal for medicinal purposes and attainable with a doctor's prescription.